Hello, everybody. This is Gary. Today is February 7th, 2022. It's 12:49 p.m. Eastern Standard Time in the United States in Rochester, New York. And this is my Coping with Schizophrenia blog entry for today. Today is the first time I've done a video in a couple of days. I apologize for that. I got off schedule, but I'm doing pretty well right now. My physical pain isn't that intense today. My anxiety levels are pretty much under control. My paranoia and delusions are pretty much under control. My auditory hallucinations are at a bare minimal. My depression and anxiety is not that bad. Um, haven't made a video in a couple of days, got off schedule, and now I'm getting back into schedule. I'm on my third day of being on the antidepressant Cymbalta, which I'm taking for physical pain in my joints, my nerves, and my muscles. They're not exactly sure what's causing the pain, um, but Cymbalta is known to help with pain in the nervous system, muscles, and in the joints, things like osteoarthritis. Um, I did get some x rays done a couple of weeks ago, and they came back. I do have bone spurs in my left and right knee. I have bone spurs in my lower spine and possibly some of my other joints that they haven't even x-rayed yet. Um, I have been referred to the orthopedic specialist to have a consultation about the bone spurs and some of my joints in my back. Bone spurs are just like extra bone that grows in the bone joints that aren't supposed to be there. It's not quite the same thing as arthritis, although I also have arthritis in my upper spine and my left hip, which certainly contributes to the physical pain that I'm having. I am back on Neurontin that I'm taking for the physical pain. Originally, the Neurontin was prescribed for anxiety, but when I tried to go off it, that's when the physical pain started, so I went back on it. But the bone spurs and the arthritis in my joints are definitely contributing to my physical pain. I have to call the orthopedic specialist and set up an appointment because I saw my primary care doctor on Friday and she referred me to them to call them to set up an appointment. I'm still going through physical therapy for the physical pain. Most of the physical therapy so far has been centered on exercising my lower body, my lower back, my legs, my hips. Also, I'm doing exercise already, anyways, on my exercise bike, indoor exercise bike. When the weather gets good again, I'll take my bike outside and ride it outside. Um, but as far as my schizophrenic symptoms, my schizoaffective symptoms, they're pretty much still under good control. And they may even get better because Cymbalta is something I'm taking for physical pain, but it's also an antidepressant and it can be used to control anxiety and depression, which I certainly have my fair share of. So taking some may help me with the physical pain as well as depression and anxiety. Um, I'm still on Klonopin for anxiety, and I'm still taking Zyprexa as needed for psychosis and the intensity of my hallucinations, my auditory hallucinations, as well as any intense paranoia. Um, I'm on a pretty long list of medications right now, so I have to juggle several different medications. I'm also taking Flexeril for the muscle pain, arthritis strength, Tylenol for the joint pain, and like I said, I'm taking the Neurontin. But other than that, my symptoms are pretty much under control. My psychiatric symptoms. And tomorrow I'm going to group. And I did see my psychiatrist last Thursday. He's the one I first asked about taking Cymbalta for pain, as well as depression and anxiety. And he suggested that he's willing to prescribe it, but he wanted me to ask my primary care doctor. She wanted to be the prescriber of the Cymbalta, and she decided she was going to prescribe it instead of the psychiatrist. I mean, either way, it didn't matter to me who prescribed it. Um, it's just that I feel like I'm finally making some headway in mistreating the pain that I've been suffering through for the past 6 weeks or so. And then it's been about 3 months actually since I've been to the psychiatric emergency room, which is good. I'm more stable over the past 3 months or so. October 30th, I think, was the last time I went to the psychiatric emergency room. Going to the psychiatric emergency room is often counterproductive because it's chaotic, it's noisy. It can even be violent. It's overcrowded, it's really chaotic. You can't really describe it unless you actually go there and see what it's like. I mean, the nurses and doctors do the best they can, but they're overwhelmed. Um, like many psychiatric emergency rooms are overwhelmed. It's very rare they're not overwhelmed. So I try to avoid going there if I can. Um, Still sticking to my daily schedule and my daily meditation. I got some essential lavender oil for helping me meditate at night before I go to bed. Kind of expensive, $17 for a small little bottle, but it helps me relax. Um, Meditation twice a day is still part of my daily schedule.